Hi there, everyone. My name's Adrian Hayter. I'm a GP and the National Clinical Director for Older People and Integrated Person-Centred Care at NHS England and Improvement. I'm really pleased to be here today on this panel, thinking about a digital assessment framework and looking at the work that's going on in care homes. I'm going to introduce the rest of the panel and let them introduce themselves. So over to Tumsilla.
Hi, I'm Tumsilla Sethi. I'm Director of PCN Transformation for Bexley Health Neighbourhood Care. That's the GP Federation for the Bexley Borough in London, and we have 4 PCNs.
Thank you.
Hello all, this is Vijay Pundi here. I'm the Managing Director and Solution Consultants from Yexle. We work very closely with Tumsilla and her team in order to enable IT solutions for digital assessment.
Great, thank you very much, and I'm really grateful to kind of kick off this session, which I hope we're going to find really interesting today. I think we're going through a pandemic at the moment in terms of this new disease that's been affecting people. And what we know is that older people, especially the most vulnerable who live in care homes, have been the ones who've been most affected by this disease. And so the work that was going on beforehand in NHS England and Improvement has come at a really timely, in a timely way, to be able to address some of those things that were happening or that are happening now with this COVID pandemic. I wanted to really start with before the pandemic and the work that went on with the long-term plan. And the long-term plan really was a blueprint for us to be able to work over the next few years in the NHS to be able to address some of the real issues that are affecting people in our communities. Involved the funding settlement of £20 billion a year by the year 2023. So real investment in services, and for the first time, an investment in the services that are going into the community, into general practice, into community services, the places where people are, where we can support people as close to home as possible. In that long-term plan, we developed some programs which were around an aging well population. And thinking about that aging well program, we've got 3 main elements which we've been working with on NHS England, which will be a feature over the next few years. The first is the urgent and community response, a standard of 2 hours to be able to reach into people's homes to support them in a better way, to prevent them from deteriorating, and also when they come out of hospital for 2 hours to be able to make sure that they, for 2 days, when they come out of hospital, within 2 days, have those services set up for them in their own homes. The second element is around the enhanced health and care homes, which is what we're going to be talking about today. And then the third element being the anticipatory care, being proactive in our approach to doing things, supporting people before crisis and thinking about that personalised care and support plan approach. So those are the 3 big elements of the Aging Well programme, and that's been rolled out, and that was started to be rolled out before the pandemic. During this pandemic, as we say, the care home residents have been some of those who've been affected most by this pandemic. And actually, we know that supporting care homes in the way that we can do in the NHS, integrating that care, making it joined up and making it work well for those residents is really important. And actually, it makes a big difference to people who are living in care homes. A lot of those people who are living in care homes are living with dementia. 70% of people might actually be living with dementia, and many will actually be also in the last years of their life, last year of their life even. So it's really important that we get that right. And so a big feature of that is the enhanced health and care homes, where as practices, as GP practices, we have been able to kind of come together in networks to be able to think about that support in a much better way, a much more rounded up way, through a multidisciplinary type of working, but also through thinking about that personalised care and planning approach for individual residents. And obviously care homes will vary, and this is really for the care homes who are both for older people, and those might be nursing or residential homes where there may be nursing input or not, as well as those learning disability homes where often people are at a younger age than 65 or than the older population. So throughout the country, that's been set up, and actually on the 1st of October we launched that specification, and practices are really working together to craft that MDT, to think about the standards that are important to residents, such as nutrition, such as their dental care, such as their medication that they're on, thinking also around how they might be enabled to live better and healthier lives through mobility support and through some therapy support, as well as getting the right nursing care and the right input from their medical care, whether that's a GP or a community geriatrician or other people who also might be supporting that through a clinical leadership kind of role, which is linking into that care home. So never kind of it's been more critical now than ever before to be able to say, how are we going to join up some of this care that's going on in care homes? And that joining up of care is so important to be able to make sure that residents get the right kind of care, because actually they don't mind which professional is coming in to support them, as long as it's coordinated and actually as long as it's there and fitting together for their particular needs. So we've learned through this pandemic, the second thing that we've learned is that technology can really support that, and the enablement of that technology has actually made the experience much better and actually helps professionals work much better together. And although before the pandemic, this was kind of coming in, it's been accelerated. And as GPs, we work now very much better with remote consultation work on the telephone or in video consultations. And we actually are able to deliver the care that people need in a timely way at the right time. We have to still see people, and it's really important to do that. But actually, through some of the technology, it's actually working better. In the care home setting, however, we've got that real opportunity to make that MDT really work really well for those individuals. But it's going to be reliant on the technology that's there. We're here today kind of in this virtual space, but actually what we need is it to really make sense, to work in the care homes, to work with the communication. And that's building relationships as well as the technology and putting the technology into place. So really pleased today to be part of this discussion, where actually underpinning the work that's going on with the long-term plan, with the Aging Well programme, is some of these digital enablers. And we have to do that in a safe way. So actually it's safe and secure in the way that we do this work. But the work that goes on in terms of sharing records, in terms of getting those discussions, is actually there to support the patient first, the professionals as well. And then also, I would say, to think about how input from others like relatives and other people can actually input into some of that discussion around individuals. So I'm gonna stop talking now, but I'm gonna hand over to Tumsilla really to kind of frame the next part of the discussion.
Thank you, Adrian. So a really small part of delivering what Adrian was talking about was trying to really understand the importance of building relationships between our PCN and our various homes across Bexley. And actually we found that there were frustrations that were covertly harbored on both sides. And we understood that we needed to get this right before we started to have a digital solution put in place for them. And we were also aware of research which concluded that homes with poor digital maturity generally tended to have poor CQC and resident outcomes. So we needed to understand our current digital maturity levels, but we couldn't just go in and start asking questions. We needed to build a robust relationship out of trust and respect, and that was really, really important. So to do that, we started to ask both our GP practices and our PCNs and our various care homes about their biggest frustrations. And what we found was the onboarding process from when a patient or a resident goes into a home and how it's onboarded in general practice was an element that needed to look at. We were part of the NHSE Productive General Practice, PGP, and we decided to use this as our project scope. And we had, each PCN had a partner grouping consisting of a practice and a home of choice, and we agreed to process map their onboarding processes. And then we agreed on a joint session to agree the pathway to do this. This piece of work is still ongoing. We're in the final weeks of it, and it's led to reduction of inefficiencies. But most importantly, it's built really robust relationships on both sides of the organizations. And we've now agreed to work on other inefficiencies. And our next project, starting in November, is around proxy access. So the relationship has put us in a position to look at just basic digital maturity. That enables us to go back in and ask those key questions to understand their area of work. And to do this, we're working with Vijay and his team to build a scalable and repeatable process to collate information. But also, as part of what Adrian was saying, we've also built a digital tool called Share My Care. And Share My Care looks at connecting various elements of the patient flow process, which is being talked at another session, and you may have heard that, and how the patient flows through the system, including coming out of general practice into care homes and connecting that to social prescribing. But one of the key elements is the questionnaire of digital maturity and the care home specification outcomes. So I'm going to hand you over to Vijay.
Thank you, Tumsilla. Thank you, Adrian. Yes, as you all said, we are trying to actually have technology try to bridge the gap between the relationships, the records, and ensure that we are able to understand what the maturity of the PCN or the care homes are. So rather than me actually talking about it, I've quickly created a demo. So you could actually have a look at it to see how digital maturity is more configurable, can be very, very easily rolled out. Not just the digital maturity alone, any type of assessment can be quickly created and rolled out, and how this can actually, in a unified manner, be integrated with all other systems to provide a single consolidated view. Hello, good morning, good afternoon, good evening, wherever in the world you are. This is Vijay Pundi here. A quick introduction. I'm a technology executive with over 25 years of experience in software consulting, management and delivery of very large transformation programs with specific focus on innovation, thereby delivering customer value and customer success. I'm a director of Yexle Limited. I also double up as a subject matter expert and a product owner for all of our solutions and accelerators. And today I'm going to give you a quick demonstration and an overview of one of the frameworks that we're using for digital assessment at BHNC. As far as the assessment goes, what do we think the current challenges are? Is, they are heavily reliant on manual processes, thereby introducing a massive risk of missing deadlines and questions in the assessments. Different NCs use different survey tools, right? These could be available online, they could be outsourced to different survey agencies. Sometimes there is also bespoke custom IT development that is involved in creating the assessment forms. NCs can have their own surveys, or they can actually have to complete national surveys. So different types of surveys are triggered at different points of times, and it makes it extremely difficult to track these manually. Right. As a result of this, There is no single view or a single location where you could record all the assessments that have been rolled out, the types of assessments that are there, what are the deadlines for the assessments, etc., etc. So lack of this single platform implies it becomes extremely difficult to capture the outcomes of the assessments, to identify the root causes related to them, and in fact take any kind of remedial actions on this. All in all, there is no integrated system or a mechanism available to create, roll out, collate, track, view these assessments in one single location. This is where Yexle's QAF, the question answer framework for BHNC, comes into play. We've actually created and implemented a total design paradigm to meet all these challenges. Right? What we mean by that is the framework that we've created is very, very configurable. Right? As clinical directors or as practice managers, they themselves can roll out this framework, this assessment, rather than having to go through a software development life cycle or having to outsource it either to online survey platforms or to agencies as well. This framework not only can achieve rolling out digital assessments, but it can also be extended above and beyond to other types of assessments as well, which you will see as you go through the presentation. The concept is actually very simple, right? Let's say a clinical director would like to roll out an assessment. What they have to do is they have to create a set of questions. They have to configure what type of response they expect for these questions. Once they have done that, they have to actually put them into an assessment. They can configure, they can determine the sequence in which the questions have to be asked. What are the weightages that are associated to each of the answer that is going to be provided as part of that question. They can also determine the overall weightage and the red, amber, green statuses of that assessment. Once they are happy with those configurations, they can actually roll out these assessments to different groups. As a clinical director, I log into the system and let's say I want to create an assessment. So the first thing I need to do is create a question. I can create any number of questions. The system allows the user to enter a question. Instructions and help text can be provided so that they act as a guidance for the users when they complete the assessments. Format in which the answers have to basically be obtained can also be configured. Let's say in this example, I want the user, the end user, to choose a list of values from the drop-downs. I could specify that yes or no is the only answer that is applicable for this drop-down and create a question. Another example could actually be a text box where the clinical director can determine how long the character has to be and even provide any kind of a validation message and configure the questions. Once the clinical director has created all the questions, they are now ready to put them all into an assessment. All they have to do is create an assessment and add the questions to it. Once they have added the questions, they can determine the sequence as well and intelligently say, should there be a following question? So in this example, only if the user is selected, if they have an NHS email, the clinical director would want this question to come up. So if it's yes, they could specify it that way. And similarly, only if there is a Wi-Fi available in the building, they could ask the next question to say, what the signal strength is like and who has access to the Wi-Fi in the building. Not only that, they can also assign weightages to each of the questions. They can also specify if these questions are required, not required, mandatory or not. And if they have marked it as mandatory, the system would not allow the user to submit the question without completing them. The clinical director can also determine a rating to the entire assessment depending on the weightage. They could say it's a red rating if the weighted score is 10 and under, or amber if it's between 11 and 30, and green if it's basically over 30. What this actually helps is, it would help the system to automatically calculate the weighted value and determine what the next steps after the assessment should be. So say, for example, if the weighted score of the assessment is red, the system could probably be configured to prioritize maybe allocation of iPads to these care homes, right? So once the assessment is completed, or once the clinical director is happy with this, they can complete this and it's ready for rollout now. Once this is completed, they can roll this assessment out to multiple care homes. The clinical director could say they would want to roll this out to a nursing home. They could specify a deadline by when the task has to be completed. They could probably again roll this to a residential home, specify a different SLA, for example, by when this has to be completed. Once an assessment is completed and it's rolled out by the clinical director, let's say I log in as a care home manager, I would have a task to complete this assessment. I would also have a deadline by when it has to be completed. On clicking of this, I could actually get the system to provide me the instruction that I had configured, the help text also that would help provide guidance for the user as part of completing this assessment. I could choose different values here. The moment I say yes, the system intelligently asks the next question, where I can complete a meaningful answer. Sorry about the spelling mistake. I can also specify if there is Wi-Fi in the building, and the system is going to again ask me for all the answers around this. And the moment I submit this, the system actually calculates a weightage. Depending on the weightage, it can actually intelligently take the next steps. The framework can also track reports real time. It allows the users, who have the authority, of course, to view these reports, have a complete view of the assessments rolled out, the assessments that are open, the assessments that are completed, etc. It can also provide a trend of the assessments rolled out, what is the digital maturity as well. It can do it by the assessment that has been rolled out and by the department as well, so that you can see how many have been rolled out. Has there been an upward or a downward trend over time? How many departments have actually completed the assessments as well? As we discussed before, this framework not only is used for digital assessment, but we could also extend the usage of this framework. Say, for example, we would like to roll out a ECHC service specifications as an assessment. The system can very easily do that as well. All I would do as a clinical director is to create the set of questions. Once the clinical director creates the set of questions that is required for ECHC, all they have to do is create a layout and add the questions to that, add weightages to the questions as needed. Maybe if there is any kind of a predecessor, they could also specify that one. If not, just do the weightages and submit it. Once they are happy with this, they can also define the red, amber, greens for this and what the next best action should be. And they've completed it and they are now ready to roll it out as well. Now they can, if needed, roll it out to PCNs. They could probably roll it out to nursing homes as well, or residential homes, and define an SLA towards the whole thing. If a care homes manager or a care home PCN manager or a coordinator logs in, they would be able to now complete the assessments. And the system would behave exactly like how it did before. It would, depending on the answers, pick up the weightages and submit the questions. Similarly, the system would calculate the weightages also. At any point of time, again, the trends can be seen. As you can see here, the system provides a consolidated view of the assessment. This time, it's not just the digital assessment, but it's also the service specifications. You can see an overall trend graph if needed, or you can see a trend graph by the specification of the assessment. In this aspect, we just did one rollout, so there's only one small dot. There is no trend graph. But at an organization level, you could see the entire trend graphs. You can see which of the departments have completed what specifications, so on and so forth. It makes it completely easy to configure, roll out any number of assessments. As you can see, it's extremely easy to extend the framework to beyond digital assessments. So some of the areas could be rolling out of smart devices, rollout of assurance questions as aligned to PCN service specifications. That's what you saw now. Any information that the care homes need to ask as surveys. This can actually be very specific to care homes PCNs, or it can be any national survey. Any feedback for patients and organizations using telehealth medicines. Once they've used telehealth medicine, you can have this feedback or survey kicked off at the back of the usage. Any kind of assessments, not just assessments, it can also be used for recording and capturing employee satisfaction and many, many more. Right. As you can see, this provides a complete, correct, and consistent mechanism to generate and roll out assessments. And the SLAs also ensure that they can be rolled out, tracked, and closed on time. Right. This is a framework that can be used to create various types of assessments, as you've seen. What this ensures and helps is it totally reduces the cost and of ownership. It gives a significant return on investment. It can help monitor progress and assessment in a single unified location. And it can also support wider PCN agenda and service objectives. Right. As you have seen, there are weightages. You can also have red, amber, green statuses and the next best actions, as a result of which the system can seamlessly or with interventions, without interventions, take remedial action. So one of the examples, like what we were saying, is as part of the digital maturity assessment, if the weightage was red, the system can immediately trigger off prioritization of providing smart devices for these care homes, depending on the weightages. And as you see, it reduces the time taken to roll out a survey. It can also improve the end user experience. It can improve satisfaction because the surveys are done on time, they're completed on time. It provides a lot of diligence and it drives overall compliance. I hope this provided you all an overview of the application, the framework that we've used in BHNC, and its extensibility and scalability. Any questions, feel free to give me a shout. Thank you.
Thank you, Vijay, for that. Can I hand you back to Adrian for any closing remarks?
No, that's really great. I just think it's really important to think about how we work across the sector, which is really there's great variation in terms of their maturity around this. In general practice, we expect the digital kind of support to be there and available to us, but actually that's not the place. And really kind of starting with the basics, being able to really understand what's going on is really that first bit of the approach. And then being able to really kind of then build on that so that there's a really secure foundation to the work that's going on. This is not a short-term thing, it's a long-term thing. It's going to be able to kind of underpin some of the work that's going on around health. And before we get to the new kind of joined up care programs that are going on, we really need to start with all the basics. And this shows how a PCN can adopt that, be able to gather all the information, especially in areas where perhaps there's quite a large density of care home residents in a particular PCN, and being able to understand that variability, work with that variability, is really part of this maturity matrix, which is so important. So really pleased to see that that's happening down in your patch, Tumsilla. Vijay, do you just wanted to? I just wondered whether it might be worth kind of just thinking about how the security, I suppose, in terms of understanding the underpinning work. You mentioned NHS Mail in the thing, in your comment there, and how I suppose care homes are going to be supported to use NHS Mail to ensure that they have the standards that are right, to be able to develop that. Some of this work will help with that. I would have thought as a basic first start, to be able to then set the platforms really right for their work.
I mean, we just showed the tip of the iceberg, essentially, right? So along with the assessment, not only can you do the weightages, but you can also have KPIs and key areas that you want to focus on. You know, if the weightages are much lesser on those questions and areas, you could still trigger to say that these are the problem areas, problem points that have to be solved first. That can also be prioritized. I mean, that was the idea of creating this kind of a framework or an assessment.
Yes.
And see how it can scale to much more than just collating data.
That's right, and it seems to be kind of flexible enough to then, if you were looking at some of those security standards, to be able to then support the homes in kind of understanding those standards, supporting them with the material to be able to make that process work much better. And I think that's a really kind of good way of looking at it. And I think that as the equipment goes into care homes, you know, the bits of tech, you know, through the joining up care program with NHSX, we're supplying care homes with iPads and with the ability to link into NHS Mail. We also need this approach, which actually helps them support adoption. And one of the things that we really know that with tech is actually around the adoption of the tech, which everything kind of depends upon. And you know, the Wi-Fi connection or the connectivity is one of those fundamental things. So really great work that's going on in Bexley and beyond in terms of kind of how you're tackling that, how the clinical directors are engaged in that process of understanding and being able to understand in their particular place, their locality, what's happening with various care homes. We know that there's some care homes which are really small, maybe kind of 15, 20 residents, to the bigger care homes, which may be 200 residents, all with their different problems, with their different resources, which we've got to really understand before we implement a large digital agenda around joining up care. Tumsilla, is there anything from your perspective really that you've had some early feedback in terms of the process and how it's working?
So it is very early. We've just started it. The key part is the building of relationships and talking about digital maturity as part of the work we're doing with onboarding and proxy access. So this comes hand in hand with really understanding and starting the journey of digitalization of our PCNs and our key partners and stakeholders.
Okay, well done, great, thank you. Great, well we look forward, I think, to kind of hearing from people and actually answering their questions. At the end of the day, this is about care home residents. It's about what we put into place to be able to make their care better, and underpinning that is, I suppose, some of the basics which we need to get right, so that the information and the communication across health and care can actually work, and that's integration, isn't it?
Yeah, that's right.
Absolutely.
Thank you very much.
Thank you.
Thank you.